What's up?
To explain how cardiac murmurs are produced, we have to know that in our cardiovascular system, blood can flow in laminar fashion or with turbulence. In normal condition, blood moves around the body in orderly fashion, all at once simultaneously and in the same direction. Such flow called laminar flow, and as we see, it's efficient and unchaotic and thereby silent. Because such flow do not cause chaos, such flow do not produce significant noise. But the problem is that our cardiovascular system is not a straight pipe. We have various conditions that can create some anatomical barriers, as valve abnormalities or such pathological structures as atherosclerotic plaques. And all of them at particular regions can decrease the diameter of the pipe. So basically, they cause an obstruction to a laminar flow, and when fluid crosses such structures, these anatomical barriers disrupt the laminar fashion of the flow. The analogy is the driving of the car. You see, when car meets a barrier, car crashes. But fluid cannot crash due to its physical properties. Fluid just evades the barrier. So when fluid comes in contact with an anatomical barrier, these straight lines transform into absolutely chaotic lines that we call vortexes. And exactly creation of such chaotic lines we call turbulence. The signature feature of vortexes is that they create vibration of adjacent structures, and this vibration produces noise, and such noise we call murmur. In cardiology we call this cardiac murmur. And exactly this vibration that we called cardiac murmurs we can determine with the help of stethoscope during the physical examination. So the most obvious analogy of such noise is the turbulence in the airplane.
You know, statistically, the chance of a plane going down because of turbulence is less than what? 1 in a billion? Or is it a million?
So basically, as we said, cardiac murmurs are produced by vortexes. Vortexes are created by turbulence. The most important question is which factors create turbulence.
Right, you like this?
The factors that create turbulence can be described by Reynolds number. Reynolds number is directly proportional to fluid density times fluid velocity and diameter of the vessel, and inversely proportional to fluid viscosity. First of all, we have to know that diameter and velocity are related. Velocity is inversely proportional to diameter to the power of 2. So usually, with increasing diameter, velocity decreases. The way to look at this is that diameter here basically tells that the larger is the vessel, the louder is the noise. So for example, the murmur in aortic vessel will be louder than the murmur in some peripheral small artery.
It sounds pretty badass.
How is this important right now?
It's not. I'm sorry.
From all these factors, the most important one is the velocity. To explain this, we have to know that fluid has energy, and this energy is described by Bernoulli principle.
Fuck me, hold up. What's that?
According to this principle, fluid energy consists of pressure energy that is created by the heart contraction, because when heart pushes blood into the circulation, it gives fluid energy that drives fluid through the circulation. Also, fluid has kinetic energy, and kinetic energy is determined mostly by the velocity of fluid. The higher the velocity of fluid, the higher the kinetic energy. And also, fluid has potential energy, which is the energy of fluid itself. And because height of the fluid column is basically fluid volume divided on area, we can see that potential energy is determined mostly by the volume of fluid. The higher the volume of fluid, the higher the potential energy. And the sum of these types of energy is constant at every point of the circulation. Basically, the idea here is that if one type of pressure decreases, another type of pressure increases.
Did you understand a single word of what he just said?
So for example, we have aortic valve, and during systole, heart push blood from left ventricle into the aorta. In normal condition, during systole, valve is fully opened. So let's suppose that all fluid by laminar flow goes into the aorta. But in case of severe aortic stenosis, the radius of the aortic valve decreases due to the calcification, for example. So what happens is that with decrease in radius, the volume of fluid at this particular point of the circulation decreases. With decrease in fluid volume, hydrostatic energy decreases, and as we know, the sum of energy is constant. So hydrostatic energy transforms mostly into the kinetic energy. Because the main factor that determines kinetic energy is the velocity of fluid, decrease in hydrostatic energy causes increase in velocity of fluid at this particular region of the circulation. So decrease in hydrostatic energy gives a huge boost to the velocity of fluid. With increase in velocity of fluid, Reynolds number increase, and when Reynolds number exceeds 2000, turbulence becomes significant enough to produce a lot of vortices. So these linear lines transform into the chaotic vortices. The more vortices are created, the more significant vibration they produce. The more severe the vibration, the louder is the noise, thereby the louder is the cardiac murmur.
I like it. Simple, easy to remember.
And as we know, we have loud intense murmurs and weak murmurs that are practically silent. And knowing how murmurs are created, we can guess which murmurs are the most loud. So first of all, the more severe is the obstruction to flow, the louder is the noise. And also, the larger is the vessel, the more likely that the noise would be loud.
Great. Fine. Yep.
Ciao. What's that mean? Ciao. It's Italian. Means food.